Today is the 11th of July 2024, and the UK has a new government. Today, we're going to be exploring the 5 key priorities for the next government to build a better and healthier Britain, as outlined by the Health Foundation, friend of EGP Learning. So let's enhance your primary care and learning. Let's go.
Hello, EGPers. Welcome to this episode. Myself and Andy are going to be talking about basically the results of the election without knowing them, but at the same time,
Yeah,
we've that.
We've got a little secret for you. So it's not actually the 11th of July as we
Yeah.
record this. It's actually the 4th of July, and the election is happening, and we don't know the outcome. But we do know that the next government will have a tall task in terms of turning around the health service and improving the health of the country. And that's what we will be exploring today.
And using that, as Andy mentioned, we're using some documentation from the Health Foundation, friend of the podcast and stuff, and basically looking at analysis that they provided and how this may impact general practice, primary care, healthcare, and all that stuff with whoever's in charge. So, shall we have a look at it, Andy?
Yeah, but if you bring me on screen, Gandhi. So we spent some time with the King. Oh, I'll have to share it with you first. So we spent some time with the King's Fund's election centre when we were reviewing the manifestos, and we said, "Oh, the Health Foundation have also done some great analysis as well," and that's where we'll be spending time today. So they have a good election centre. It might not be there on the 11th of July when everybody is having a look as they watch this podcast, but it's there now, and we're going to be looking at their priorities for the next government to build a healthier Britain, a healthier nation. So the Health Foundation are really quite good at exploring the wider determinants of health. So I guess most of our audience out there will be familiar with this concept, but for those who aren't, do you want to explain what we mean by the wider determinants of health, Gandhi?
So I guess these are the things that have an impact on your health. So we often commented about the fact that your medical health makes up 20 to 30% of your overall health. And then there's definitely other factors that have an impact on your health. So for example, where you live, your education, finance, all that kind of stuff. But then there are conditions that have an even deeper impact on that. So they're the determinants of health. So actually your educational level does have an impact on your health. You know, the transport access that you have for various different things, what demographic you are from has an impact on your health, and various other things, including both conditions and things that are outside of your control as well.
Yeah, income, social class, green space, transport, exposure to pollutants. So, and actually, they say that about 20% of your health, the outcome of your health, what happens in terms of the health in your life, is determined by your access to healthcare and the quality of the healthcare that you have access to. And actually, 80%, the vast majority, is determined by all of these other things. And of course, those other things are things that the government can influence in terms of its more general policies. So the Health Foundation is really quite good at making recommendations in terms of other policy as well as health policy. So we'll be spending some time with what they identify as the key priorities for the next government. So there's a nice infographic here, and I think what we'll be doing today is just spending a little bit of time with each of those 5 things. Really, we'll have a look at what they've identified as priorities. We'll think about how they might influence general practice, and maybe we'll have some priorities and some ideas of our own as we go through, Gandhi. But just to put them out there, the priorities are: 1, investing in health as an asset and a priority for cross-government action; 2, improving people's health and tackling inequalities; 3, strengthening capacity and resilience in the NHS; 4, transforming care through innovation, technology, and reform; and 5, reforming and investing in the adult social care system. So all quite big, chunky pieces of change and legislation. And for each of them, they give a little bit of context, and then they talk about their priorities for action, and they link through to other documents that you might read. So it really is a really good article to spend some time with, really. So investing in health as an asset and a priority for cross-government action. So the sorts of things it's suggesting here are really making it a something that is a goal for the government that cuts across all the different departments. So they're talking about, setting an ambitious goal to improve the nation's health, something similar to, say, the zero carbon type pledges that are sometimes made, and those become a target for kind of all government departments to participate in. And they're suggesting putting the health of the nation on a similar footing to that, which sounds great, really. Yeah. Do you got any thoughts about either the Health Foundation suggestions here, Gandhi, or your own, really, in terms of making health a cross-government priority?
I think ultimately health does need to be a cross-government priority, because part of the challenge that we've seen, particularly commenting on health over the past few years, is that the political football that is health often drives a lot of the weird changes and policies that we see, and actually there doesn't seem to be some unification over what is the aims that should be. And I guess that's where we find difficulties with reorganizations of the NHS and all the other stuff that has ongoing impact in terms of how we deliver care. So actually having some aligned principles that are wider than individual parties that are in power probably would be more sensible and actually more effective.
Yeah, I think that would be great. And they're talking about cross government, so cross government departments, and I think actually going further and going cross party and having um, a Westminster wide agenda would be really, really good. So and they're talking about having that cross government strategy and linking that to the Prime Minister's office. For example, so that there is a very senior sponsor. This is quite NHS sort of language. When we have projects, we have senior sponsors, and the idea is that that's somebody with the connections and the clout to help support a project through and provide the air cover and provide the an entrance for that project into all the other departments, to make sure that people take it seriously, really. So that sounds really good. I think that sort of sits above all the other things that they're suggesting, really. So they're talking about making health a priority, making health, making prevention, and preventative medicine and those principles a priority across government, and making sure that where they are doing other things like economic development, that consideration of health impact is and health inequalities is baked into that. So that sounds really, really,
Yeah.
really, really good. And I wouldn't expect any less from the Health Foundation, really. Number two, they were talking about improving people's health and tackling inequalities. So we both work in what would be described as economically deprived areas. So I think this is quite important to us, really, isn't it? And it's the sorts of things they are talking about is really going after those big risk factors: smoking, alcohol, obesity. I think, is this where they talk about taxation? I'm just reminding myself, but I think somewhere here they talk about using government levers to really address those risks. We've talked about how legislation can really, really help. The smoking ban in public places, that happened years and years ago, was really, really instrumental in reducing smoking levels, for example. There's talk in this election about going further, wasn't there? Making it so that somebody who is not an adult now could never buy cigarettes going forwards. A number of the parties adopted that in their manifestos. So those sorts of policies coming through would be really, really good. So they're making, so this is covering those sorts of suggestions. Is there any particular policy you might like to see in this, if there was a policy to tackle health inequalities, Gandhi?
I think there needs to be some consideration of the investment into areas where health inequalities are more stark, and how do you prioritize that? So one of the things we all know in general practice is the Cahill formula is considerably out of date and doesn't in any way incorporate health inequalities in a decent way to help tackle the need of the population and therefore the resources and the funding it gets. So if we're looking at a GP, general practice perspective, actually the best way to help with that would be to modify the Cahill formula, or basically just come up with something completely different. But it's always consistently one of those too big to tackle problems. And actually, because of that, we continue to face increasing health inequalities to the point where, practice populations that have some of the most stark needs actually get less comparative funding than areas where that's the reverse.
Yeah, you're absolutely right. And it's really difficult to tackle, isn't it? Particularly in an environment where funding in general is static or going down. I think it's easier to tackle where the general tide of funding is rising, and you can have some people still rising, but not rising as quickly as perhaps funding in deprived areas, but where nothing is rising, and actually making a differential between the two means lowering people's funding. It just becomes really, really, really hard to do. Some things that caught my eye here in the Health Foundation's recommendations were reducing economic inactivity and improving health for people in work by taking a coordinated action to address barriers to work due to ill health. So I thought that's interesting. And actually, the Conservatives were making some of those noises before the election. And I think perhaps similar noises from other parties, but actually supporting people to work better. We know that work in general is generally good for people's health outcomes, and health and life chances. So that's an interesting suggestion. I think quite valid. And then they do talk about actually better investment in public services, because actually people at the lower end of the income spectrum tend to disproportionately use or be reliant on public services to one degree or another. So that's a way of tackling health inequalities and improving outcomes for people on lower income. So I thought that was good. I mean, they're sort of big goals, aren't they? And I think within each of these, there's a lot for people to kind of run with and then work out the details in terms of how they actually achieve these. Strengthening capacity and resilience within the NHS. So there are some things that it suggests building on here, actually. So, building on the long-term workforce plan, commit to fund the expansion in the workforce. I guess as GPs, being aware of the GP employment crisis, we would say it's one to train more staff, which is in the NHS long-term workforce plan. I think at the time when we reviewed the document, there's not necessarily much here in terms of paying these staff once they are trained, retaining them and actually expanding the budget to actually pay them once they're trained. There's big training goals. And that's the problem that we're finding in general practice, isn't it?
Yep.
The core budget is not going up. The number of qualified GPs out there is going up because training places increased. And we have doctors that people can't afford to employ, and stories of Uber drivers working in Tesco, qualified GPs doing those roles because they can't find work as GPs. It's absolutely ludicrous. But they talk about building on the NHS long-term plan, which is great. They talk about modernising crumbling buildings, infrastructure investment in buildings and equipment. They talk about increasing productivity in the NHS as well. And I think in their narrative, they talk about actually there have been funding increases, particularly in hospital care, and that hasn't necessarily been matched by increases in productivity and people moving through and out of hospitals. So suggesting actually some exploration of that and reform would be needed as well. So interesting. The next big area is transforming care through innovation, technology, and reform. Gandhi, can I play a game with you here before we open and look at their priorities for action? What would be, you're an innovation and tech guy, so what would be your what would you suggest here in terms of making an impact on the nation's health?
I think the one thing that would make such a significant difference to the nation's health is having a truly interoperable healthcare record system. Because actually one of the most inefficient parts of the healthcare is the fact that information doesn't flow effectively. It's still siloed, and actually we end up duplicating so much stuff because we just don't have access to the information for that individual patient across not just primary care borders, but actually wider than that in terms of secondary care and tertiary care. And actually direct ability to share would streamline care so much more effectively than anything else, in my view, in terms of any other intervention.
I think that's probably the number one, Gandhi. Let's hope it's there, because it is a big frustration. And I often come across patients who they assume that that's there. I was looking after patients probably 15 years ago, when I was a house officer, who would turn up and think that you could see their GP record when you were clerking them in hospital, and wondering why you're asking them all sorts of questions, and didn't know why they had certain health conditions, because they assumed it was all linked up, and it's still not linked up 15 years later. So let's have a look what they're suggesting. Avoiding top-down reforms and structural change, putting patients first. Okay, that's fantastic rhetoric. Bold new national coordinated approach to transform the delivery, quality, and experience of care through faster development, evaluation, adaptation of new technologies. So, they sound a little bit wordy, don't they? But actually, the speed of adoption of new technologies is an important factor. I think integrating and coordinating services better. They're not talking about a single shared record here, but maybe their expectations that will fall out of some of these bullet points. But I think that's maybe it's not exciting enough, but it is difficult to do, and it would be quite revolutionary. And they talk about the adoption of AI across the NHS as well, and effectively regulating that. So, okay, that's interesting. Not very specific, but maybe that's not their intention. And then the final one of their 5 points was reforming and investing in the adult social care system. So, I mean, this is really important, is it, for a number of reasons. I think as GPs we have quite a lot of interaction with the adult social care system in terms of the care delivered to people in their own homes to support them to remain independent there. And of course, care homes are a big part of that sector, which many of our patients are cared for in and are discharged to following hospital. And I think one of the big impacts that the social care system has on the NHS is that often for patients to move out of hospital, they need safe care to be in place. And that's often delivered by the social care system, either private or local authority funded carers in their own home or care homes. And often it's difficult to get that in place in a timely fashion. Patients remain in hospital. Hospital beds are occupied, and eventually that backs up to actually there aren't beds to move people to from emergency departments. It's difficult to move people into crowded emergency departments from ambulances. Ambulances are waiting in emergency departments. That means that they're not available to respond to 999 calls, and people have an increased wait for ambulances. It all kind of filters back. So vitally important. What would you do, Gandhi, to reform or invest in the adult social care system? What would be, putting you on the spot here, aren't I?
And that's a tricky one. I think the challenge with social care I often find, and again, it's going to come to a similar thing, it is communication. Well, no. So let's assume that we can't change the funding picture, because actually this is the thing we keep hearing about. So if we're thinking of other options, absolutely better funding for social care, and particularly carers who do so much work that is just completely uncaptured and stuff. But actually, I'm going to go back to this data sharing aspect. Actually, carers being able to support the people they're looking after by understanding their health challenges more effectively with consent. Appropriate consent obviously is important. But also being able to share that information back to the health services and actually have the ability to support the individuals they're looking after with metric-based data, that kind of stuff that actually streamlines, again, the healthcare that they're offering. Maybe then we can move more towards a prevention rather than a reactionary care system that actually benefits the individuals themselves.
That sounds good, Gandhi. Shall we see what they've...
Sounds expensive.
Yeah, it's difficult, isn't it, without doing something about the funding and the wages in that sector, levels of training, the morale of people delivering these services. Okay, so fairer and more generous state protection against the costs of care, and pooling of risk across the population. So actually, that is a way of addressing the funding. I mean, essentially, there will be a cost to doing that, which they're acknowledging, but I think they're talking about sharing that cost across the population, accepting there is an increased cost and sharing that by pooling risk, either through paying through taxation or other state protections. So, okay, that sounds good. Increase the investment in the current system of publicly funded care, tackle unmet need. A fully funded long-term workforce strategy. So I guess we've had the NHS workforce strategy, and actually looking at the type of people that we need in care, the numbers of people that we need in care, and setting some strategy to meet that. It sounds really, really sensible, doesn't it? And they talk about improving paying conditions for staff as well, which people do a very, very difficult job, and it's criminal, really, that people are only paid minimum wage for these really, really difficult jobs. And it would be fantastic to address that. Pardon me. And they're talking about supporting unpaid carers, actually. So it's useful to see that in here. And they're talking about increased access to respite and support for unpaid carers, which and actually acknowledging the huge contribution that unpaid carers make actually to looking after neighbours, friends, family members. Sorry, people at home, bit of a frog in my throat. So let's go back up to the top and just remind people of all of those 5 priorities. So health fund, there's lots of great stuff on, I call them the health fund, it's the health foundation, isn't it? The health foundation website. Yep. They're particularly good around the wider determinants of health and health inequalities. Please do check them out. And their priorities for the next government, which will be in place. We don't know who they are because we're recording this before the election results are known, but they are suggesting we want invest in health as an asset and a priority for cross-government action, make that a priority across all government decisions, improving people's health and tackling inequalities. So they were talking about funding distributions and considering the effect that other policies have on people's health, funding services effectively, etc. 3, strengthening capacity and resilience in the NHS. So following through on the NHS long-term workforce plan and addressing other very difficult issues in the NHS. 4, transforming care through innovation and technology and reform. I think we found that a little bit waffly, but successfully adopting new technologies and integrating them to improve productivity, really, really important. And 5, reforming and investing in the adult social care system. A lot of people do very difficult work. They're underpaid and the sector is not coordinated very well. So making suggestions around that. So that's that, Gandhi. Any final words or suggestions for people?
No, I guess at this point it'd be interesting to see if those people watching, what they think about these particular priorities by the Health Foundation, especially those in power. So we don't know who it is. We might be able to take a guess, but we're not gonna. But effectively, do you align to these principles and these thoughts and stuff? And how much of this do you think is a priority versus not a priority versus achievable versus into the long grass that we will see, as we sometimes do from the particular governments and things? So I don't know. It'd be interesting to see where this leads us and where this ends up for the healthcare of the population.
Absolutely. And I'm looking forward to our next live session next week when we will know who the new government is. Well, maybe we'll be looking at what's in their in tray. Maybe we'll have some more news from the GP industrial action ballot. Yep. I think that runs till August, doesn't it? But and we'll be getting all of the new news as we have the new government and the new parliamentary session. So yeah, hopefully people feel we've taken hands to primary care and learning, and we'll catch people soon.
See you later.